welcome to the Tuesday edition of the Chiefs. And of course, with us are Lucy Cruz Valdez, the head of News 5. Hi, Bossing. And
Hi,
coming
Ed.
online in a few minutes should be Ana Marie Pamintuan, the editor-in-chief of Philippine Star, and Robbie Lampay of One News. Okay, wala pa sila.
Hello, good
What's the big story
evening.
today?
Well, of course, the new protocols, especially with Christmas, no reunions, no parties. Wala, yun talaga eh, because we're coming off last night's speech by the president. And then, of course, the red tagging and the hearing in the Senate in relation to that.
And the president's colorful statements last night.
You're very tactful,
colorful.
very tactful.
Extremely colorful.
Of describing it.
But you have to hand it to Harry Roque. This morning, or at least today, he tried to put some nuancing into the president's colorful statements.
Ano nga ba sabi niya?
Ito, sabi niya. Just to summarize it first, ang sabi niya, parang sabi niya, umamin na kayo na mga komunista kayo. Kasi wala namang problema doon eh. Walang problema doon so long as you don't advocate rebellion or taking up arms. Sabi niya kasi,
akala ko nag-react siya sa colorful language.
Hindi, he was just trying to put some legal nuancing into everything that the president was saying. Sabi
niya,
actually, sabi pa nga niya, buwagin na ninyo yung inyong party list, tawagin na lang ninyong CPP. Diretso na.
Tapos, it's in line with the president saying that.
Tapos ang sabi niya, red naman talaga sila, sabi ng Pangulo. Totoo naman po yan. Ang hinihingi lang natin, you can be red without necessarily endorsing the use of arms. So it's opening that legal door na you can be communists as they claim, as Palace claims. And that would be fine, Roque is implying, so long as they don't advocate taking up arms.
Although napanood mo ba yung Senate hearing where I think, if I'm not mistaken, it was Congressman Colmenares who even said na he would even go so far as to something like this, as to say, if they take up arms, diba, that should be acceptable as far as I'm concerned. It's siguro para sa kanya, it's their way of expressing their grievance, no? So it's really, to me, the issue is really coming to the fore, no? As to whether or not they should come out as communists, because there's absolutely nothing illegal about it, right? Ang nakakatakot dun kasi yung anti-terror law, no? Parang when does, being a communist move over to being a terrorist, which is so easy for government authorities to actually
because a lot of people in government conflict that.
Yes, exactly.
I mean, there are those in government who make that distinction and who can tell the nuancing, but there are a lot of people in government who cannot tell the difference.
On the ground. And on the ground. That's
where
going to be very difficult. Yes. Yeah. So, anyway.
Oh, there's Ami. Ami Pamintuan of the Philippine Star.
Oo nga. Papapasukin na ako sa shopping mall.
Okay.
Ha? Baliktad, no?
Bakit? Minor ka ba?
Senior.
Senior citizen.
Akala ko kailangan mo ng guardian.
Hindi, yung mga minor.
Sabi nga paano daw yung mga senior dapat kasama rin ang mga parents nila?
Hindi, kasama yun ang children. Pero that's the problem na eh. Ang problema siguro, tanungin natin yung mga guests natin. Super spreader daw ang mga bata.
Mga bata.
Although we're waiting kung ano pa yung...
Kasi asymptomatic eh. Asymptomatic sila, pero dala-dala nila yung virus. Kaya parang nakakatakot. Diba?
Kaya pinaproblema din yung proposal to, di ba, yung face-to-face classes? Although
yes, exactly.
Sabi nila, they're supporting it in certain places. Para mababa yung...
In certain places, yes. But they're still denying that they're actually preparing for it, and that
Kaya, tanungin siguro natin yung guest natin kung ano sila yung mahihirapan kung sakasakali, di ba?
Oh, but let's introduce first si Robbie Lampay. Just joined us right now from One News, all the way
Magandang gabi po.
from faraway Reliance
Robbie.
Street in Mandaluyong.
Sino pinopo mo?
Si Ami siguro, si Ami kailangan ng ano eh. Si Ami pamamasukin na sa mall eh. Okay, anyway, nakapag-segue na si Ami. So, let's bring in our guests. Joining us tonight. Yeah, joining us tonight are Doctors Winlove Mojica, Ana Ong Lim, Leonila Dance, and Antonio Dance. They are from the Healthcare Professionals Alliance Against COVID-19. Doctors, good evening po, and thank you for joining us in the Chiefs.
Good evening, doctors.
Good evening.
Doctors, well, everybody's looking for that golden or that magic compromise between going with health protocols, health standards, and at the same time opening up the economy, finding that delicate balance that would allow you to have both.
And celebrating Christmas.
And celebrating Christmas, yes. So how could I forget? It is December 1. Okay. All these elements that we want to balance, I understand you had some proposals that you brought to the public. Bring us through these, go through these proposals with us and tell us what you think. How can we do this?
Who first?
Sino? Ikaw na. Sino?
Dr. Winlove.
Sino po?
Can you hear?
Yes, sir. Yes, sir. Go ahead,
Yes,
doctor.
sir.
Yeah, thank you, and thank you for having us again tonight. Let me start with the basic for our recommendations, no? Before we talk about the actual recommendations. Two things for people to think about. Una, we and the Department of Health are anticipating another surge of COVID, no? Parang nung July and August when our hospitals were overflowing. And we're expecting it for many reasons. One is that we had a lot of typhoons, storms, and evacuees, no, from the floods. And those evacuation centers were packed with people in evacuation with no protective equipment sometimes. So they could be the focus of a new surge. Pangalawa, the Christmas season is here. And as you can see from the pictures in the papers, dumadami na ang tao sa lansangan, siksikan sa Divisoria. So, expected namin. At pag tinignan mo yung curve natin na pababa na sana since August, medyo nagsuslope off ulit. At mukhang bebuelo na naman for a surge just in time for Christmas. And that is why we came up with our recommendations to remind people and to give them ways of celebrating Christmas. Kakaibang Pasko ito, and we recommend different ways of celebrating it.
Sige nga, Doc, ano yung kakaibang paraan na yan? Gusto kong malaman.
Sa inyo po, ano pong plano sa dance household and sa dance clan? How will you celebrate? Para we can take a model. Ako magsasabi ng number one recommendation namin. Our number one recommendation is if you're going, you can celebrate. Siguro that's the first message. We can celebrate. Hindi natin pwedeng i-cancel ang Pasko. And we need to go back to the original meaning of Christmas, di ba? Yung unang Pasko was very humble and very holy and dito galing sa puso. Ganun dapat ang Pasko natin this year. So ang first recommendation namin, if you have to celebrate, you can celebrate, but do it in your household. No? Yun muna ang main natin. Kasi in the household, mga kasama mo naman yan araw-araw, you're in a bubble actually, and you see each other every day. Wala namang masama within household, yung kayong mga kasambahay, mag-celebrate kayo at magsaya na wala nang mga darating pa from other households. Yun ang aming first recommendation. Yung second recommendation is kung hindi maiwasan, kasi syempre merong mga sarado ang opisina, or mga sundalong uuwi, they only have a 10-day leave, and they have to go home. Hindi maiwasan talaga kung minsan na uuwi. Then we have certain rules, and siguro mas natatandaan nila at nasasabi ni Inday ng mas mabuti yung rules kung magko-cross tayo ng household.
So, sabihin ko lang muna yung 4 na nire-recommend namin. Kung sakali lang hindi maiwasan na magkaroon ng konting pagtitipon. Una, yung kung magsasama o magkikita, sana check niyo yung ventilation, air ventilation, no? So dapat yung hindi nasa kulog na lugar, kung pwede sa may garden o sa may labas, mas maganda.
Outdoor.
Oo.
So,
Tapos, Number 2 natin yung physical distancing. Mag-maintain pa rin tayo ng 1 meter to hanggang 2 meters. Tapos yung pangatlo natin would be yung mask. Always wear mask. At saka yung ating face shield. Kahit na nandun sa yung maliit na pagtitipon na yon, ano? Tapos yung pang-apat, yung dapat less than 30 minutes. Kung sakali, wag na kayong, mas maganda yung hindi na nga kumain dun eh. Magkita-kita at iwalay na agad ng mas mabilis. Kaya ang tawag namin doon, 4 dapat. Yun.
A as in airway, P as in physical distancing, A as in always wear your face shield and mask, and T as in time. Keep it below 30 minutes if possible.
Doc,
Oh,
you talk
wow.
about ventilation.
Nakaka-depress.
Hindi naman.
Kalahating oras, mahaba-haba na yun. So okay lang yung size. Pwedeng sumobra ng, well, hindi magandang sabihin, ano? Pero ideally, talaga 10 lang ang dapat sa gathering. Yun din ba ang recommendation ng mga health workers?
Yes. Keep it to 10, no?
10.
As much as possible lahat yan, no? Siyempre, wala namang mag-check sa mga bahay, hindi ba? Pero as much as possible, keep yourselves safe. Keeping if more than 10 kasi pahirapan na sa physical distancing, no? And if you're in an enclosed area, parang mahirap na talaga.
Doc, can I go into the details?
Mas mahaba pa yung time na masispend mo sa traffic kesa dun sa 30 minutes na magkakasama kayo, di ba? Parang it's almost impractical.
Ako, ang gusto kong tanongin yung time para kumain. Can I drill down on the small salo-salo? And it's a serious question. Nandun na tayo. So let's say social distancing. What about the mode of serving the food? I mean, usually pagka sa bahay namin, di potluck, di ba? So kanya-kanyang bahay nang galing yung pagkain. Pagkatapos ihahain yun na buffet, no? Tapos kanya-kanyang kuha ng kubiertos. You're all pouring from the same pitcher. I mean, how concerned should we be about these details?
Ako na ba?
Yeah, and siguro andyan ba sila Dr. Mojica? Ayan.
Dr. Mojica.
Dr. Mojica, sir.
Hello, good evening
Dr.
po.
Winlove.
Yes, hello, good evening po. Sorry po, my connection is unstable.
Okay.
Regarding COVID naman po, hindi po yan ang main route of transmission ng COVID, yung sa fomites, yung mga nahahawakan. Sinabi na rin po nila yan, ano? Talaga pong itong 4 na recommendation na ginawa ng HPAC, yan po yung common modes of transmission. Kaya yan po yung dapat na iba yung pag-iingat. Yung buffet, hindi po yung food na iba-ibang niluluto ang dahilan kung bakit nagkaka-COVID kayo.
Ano yata,
Sabay kayong pupunta sa buffet table at hindi kayo nakamask dahil kasi kumakain nga kayo. Yun ang paraan kung bakit kayo
saliva no?
Okay. Doc, yung fomites, yung fomites, that's a very good point. No? Fomites, yung any item any physical item na nahawakan natin, ano? That's a fomite.
Yes po.
Okay, so sa buffet, malinaw yon. Tatanungin ko rin for the benefit of the ninongs and the ninangs. Yung gift giving, so ibig sabihin, fomites din yun. Ibig sabihin, hindi excuse yung mga ninong at ninang sa magbigayan ng gift.
Talagang hindi ka excuse.
Ayaw magbigay
Pwede pong online cash transfer. Pwede rin po yun.
Cash and transaction na lang.
Pero hindi po maiwasan.
Ako may tanong ako, dun sa outdoor, no? What is safe ba halimbawa kung nandun ka sa garahe na may bubong siya pero lagusan naman yung hangin? Is that safe? Okay lang 'yon.
Wala pong 100% safe. kahit na po ma-fulfill nyo po yung apat dapat, meron pa rin pong chance na magkaroon po kayo ng COVID. So, kunwari, may apat dapat, pero 100 yung tao na nandoon sa event ninyo. May chance rin po kayo talagang magkaroon ng COVID kasi malaki po yung volume ng virus na nandun, just in case na merong mga asymptomatic. Pero kung may gathering, tapos yan po, maganda pong lugar po yung garahe o kaya yung porch. Kasi mas umiikot po yung
Veranda. Yes. Oo.
Yes.
Doc,
Pero
question pa rin about ventilation. Kasi right now kasi it's encouraged to have yung mga acrylic barriers especially in restaurants. Sabihin na kahit hindi dun sa family gatherings mga restaurants may mga acrylic barriers yan I don't know this is true pero I read some articles that said that the barriers can also prevent good ventilation. In fact, the barriers tend to make the aerosolized droplets stay in one place. So you're more likely to get infected with some barriers. Is that true?
That's true. The barriers obstruct ventilation. So second best yan. The best really is open air. With just open air, parang there's a 90% reduction in the risk of transmission compared if you do the same activity in a closed environment. Kaya dapat alam nyo, manawagan tayo sa mga mayor at sa mga restaurant owners. Maawa naman sila sa tao. Why don't they put their tables and chairs outside, doon sa may sidewalk? No? In other countries, they close down the streets para yung mga tables and chairs nasa kalye. So now, automatically, we have parks in our cities, no?
Parang
plazas.
Paris lang, no?
Yes, parang nasa Europe ka, di ba? Ang ganda-ganda ng Pilipinas, pero lahat tayo nakakulob sa air-conditioned rooms where we can get the virus.
Pero Doc, before I leave that
siguro-
topic, yung ventilation po kasi yun nga, a lot of establishments have those acrylic barriers now So are they recommended to be there or should we take them out? I think that's something very practical for people to consider.
Pati sa Senado, ganyan ang sistema, di ba?
Oo.
Sa akin,
Yes.
for me, tangkilikin natin yung mga restaurant na nasa outdoor. Because those barriers, in an enclosed area, they're very little help. Kasi andun yung virus naka-lock sa room.
Yeah, but I mean, just one more point there. They're of little help or do they do
Are they
harm?
more harmful? Yeah.
Well, kung walang ventilation, I don't think they either help or harm. No? Kasi walang ventilation and the virus is in the room. No? And the air will reach you somehow through those barriers. So,
Hindi naman kasi sealed yung barrier
Oo.
So kung lalabas ka ng virus, lalabas din yung
papasok
hangin.
lang yan sa sides.
Oo. So kung nasa kulob na nasa indoor ka, kahit may barrier kang ganon, hindi ka maproprotektahan. Mas maganda pa, buksan ng pintuan
At bintana.
at siguraduhin may inflow at outflow yung ating hangin. So yun yung kailangan nating siguraduhin.
Well, anyway,
Dr.
sinabi ng government today that they are encouraging yung mga alfresco dining. Lalo ngayong siguro tanungin natin, isa pang in-announce nila ngayon, they're going to allow minors. Di pa naman in-specify yung age. They're going to allow minors as long as they're accompanied by adults sa mga shopping malls and other public places. You think that's safe? Kasi sinasabi naman ng mga health experts super spreaders daw yung mga bata di ba? Even if they don't get infected quickly, nakatira sila sa mga lugar na merong mga comorbidities, mga elderly. Kayo po, anong recommendation ninyo? Siguro we can bring in Dr. Ana Onglim.
Yeah.
No?
She's our pediatric infectious disease specialist.
Tama.
Dr. Ana Onglim, welcome po. Welcome.
Hi. Sorry,
Yes.
the connection's been bad, but I'm glad to be joining you.
Yeah.
Siguro 2 points, no, Ami. The first one kasi is referring to kids as super spreaders. siguro, kasi may technical definition yung super spreaders baka mas accurate to talk about the possibility na pwede silang manghawa even if they're not symptomatic, and we have to recognize that fact, no? Pero kumpara sa ibang mga respiratory infections tulad ng trangkaso, where recognize na ang bata talaga ang driver ng transmission, sa COVID baliktad. Mas likely silang mahawa kaysa manghawa. Ganun ang
Oh,
behavior.
really?
Yes,
I
oo.
see.
So, pero
Bakit ganon? Bakit ganon? What is it about the virus that makes it a reverse effect for kids?
well, one possibility is because of the way the virus infects kids less frequently and less severely, and therefore kung hindi sila gaanong matinding tinatamaan, then it
Yung
stands to
immune.
reason that mas hindi sila manghahawa, no? However, having said that, we're not saying that it's impossible for them to spread the disease, diba? That's not naman also true. So I think I just wanted to get away from the concept that they are super spreaders, because there's no evidence naman that they're always that
Okay.
case. Now, going to your question about kung pwede na ba silang lumabas, pwede na ba silang gumala. I think, no, as an infectious disease person, as a pediatrician, kung may magtatanong sa aking nanay, sasabihin sa akin, Dok, pwede ko na bang ilabas yung anak ko? Pwede na ba kaming gumala? Ang itatanong ko sa kanya, saan kayo pupunta? Paano kayo pupunta ron? Meron ba kayong kasama sa bahay na kung magkasakit, ma-ospital? So sagutin mo muna ako nung bago kita bigyan ng advice, kasi it has to be very individualized. Kung yung risk ng paggala mo, ang kapalit naman nun, mahawa yung anak mo at mag-uwi pa siya ng sakit, sulit kaya yon? Parang hindi naman yata, di ba?
Well, let's take the first question. Saan ba kayo pupunta? Kung ang sabihin, because we started with the premise of malls, but if they say
Right.
na pwede na raw lumabas, I just want to bring them to the park, or I want them to bring them to the campus, pwede kaming maglakad-lakad doon. Is that okay?
I would say yes, because it's outdoors and the ventilation is good. So babalik na naman ulit tayo dun sa konsepto ng apat dapat. Pagka ma-fulfill mo yung apat, out of yung apat, mas maganda.
Pero Doc, as a matter of policy recommendations
malls
po.
definitely, yung mga mall, do you think it's a good idea that minors are now allowed in malls as long as they're accompanied by their parents? Is that a good idea?
Ako siguro, I would look at how crowded the place is, what kind of ventilation they have, no? Still stuff like that. It's very difficult to give a blanket yes or no, because again, no, all of these factors need to be considered. But if I were a mall operator and I wanted to get people to come to my mall, I would say that my ventilation is good. Parang we are very strict about enforcing distancing. So that would be reassuring, di ba?
Well, Doc, of course, we do understand the need to have some nuancing dun sa sagot. Pero we ask these questions po kasi, of course, ang sabi nga ng IATF, in the end, it's the LGUs that will have to pass ordinances regulating whether minors should be allowed inside the malls. Pero po, ang nga po, with that in mind po, so what should LGUs keep in mind when they pass ordinances about minors going to malls? What would you recommend po?
I wouldn't recommend anything differently compared to what we would recommend for everybody else. Kasi hindi naman sila ibang klaseng, how would you put this? They're not a different species of people. They're still just people who need to be protected in the same way, right?
So in short, as long as they have masks, they have shields, and the malls have very clear protocols, okay naman. It's generally safe. Ganon. That's what you're saying in effect. Yeah.
Go ahead.
May
go
ano
ahead,
lang ako, may dagdag ako doon yung sinabi ni Ana na kasi paano sila pupunta doon sa mall. Kung nakita natin na napakasiksikan doon sa public transportation natin, parang hindi mo talaga mapipigilan pa yon. So kung yung LGU makakasigurado na magkakaroon na tayo ng magandang transportation sa mga iba-ibang lugar na yan, siguro pwede tayo magkaroon ng blanket na regulation. Oo. Pero kung hindi pa nila na-assure yung transportation na magkakalayo, hindi siksikan sa jeep, medyo mahirap ka magsabi na pwede na.
Yeah. So, bata man o
So, kunyari, Divisoria, may mga bata rin dun eh. Sinasama nila maanak nila. Is that something that, for example, the Manila LGU should ban outright? No kids in Divisoria.
I think they should ban crowding, period. Whether it's crowding with children or without children, crowding should be controlled. So I think it's less a matter of age. Kasi yung apat na yon, apat dapat, kahit bata o matanda, they apply. And you should know all four. Kasi kung minsan hindi mo magamit lahat ng four, you should, kunwari may isa kang di magawa, kung kakain, tatanggalin mong face shield and mask, may tatlo ka pa, di ba? Or kung papasok ka ng enclosed room, no? Kasi you have to do something, buy groceries or something, may tatlo ka pa. So, you always know those four and implement as many as you can, whether you are young or old.
Okay, Doc, let's take the other scenarios naman in the Christmas season, and we recognize these are all social, if not cultural, dilemmas for us. But as you know, they've also shortened yung curfew hours. It's now just 3 hours. And ostensibly, a lot of this has to do with accommodating the coming Simbang Gabi season. So letting people go to mass. This is hallowed tradition. A lot of people really do it, but this is really a gathering of the public. What are the concerns and the reminders there?
Actually, may ano yan. So may concerns like, crowding at night or yung mga naglalasing. Pag naglalasing kasi, malilimutan mo na yung apat na yon, di ba? Baka kung may matandaan kang isa, swerte ka. Pero I think that's minor. I think mostly there are benefits. So gatherings at night tend to be, kung simbang gabi, basta control ng crowding, okay naman. And meron pa hong added advantage. We've been trying to request for a shortening of curfew for the past months para yung travel time humaba, no? So some people can travel very early para mas stagger ho yung travel hours, no? Inisip namin work hours, merong mga early morning magsimula. Yung iba naman na hapon na nagsimula, pwedeng late evening mag-travel. So you lengthen travel hours. And it's one of the solutions kasi limited ho talaga yung ating transportation services is to lengthen yung operating hours of the trains and buses as much as we can. Kasi meron din namang technologic concerns or difficulties in making them run 24 hours. So we think that's okay to shorten or remove the curfew hours.
Okay, but we ask also. I mean, and that's a fascinating insight. It's a new insight, and we could see the logic there. But we also ask in the context of, when we interviewed, for example, Father Austriaco of Octa Research and so on, he did note that, if you look at South Korea, if you look at other countries, religious gatherings was undeniably really something that was a spreader. He even theorized that, for example, in mass, people are singing, people are constantly have their mouths open when they sing, and so on. It's these things that I was asking about. The details of the rituals and the traditions. Are there concerns and reminders there as well?
Well, yes, madami. Yes, singing is causes aerosolization, no? So it enhances transmission rates. Talking loud does that. And of course, crowding in enclosed areas in religious places. Alam niyo yung kagandahan ng apat dapat, they will work anywhere. In church, they will work in restaurants. These four will work when you're traveling in buses and trains. No? So we think it's a very good mnemonic or a very good way of remembering, no? Apat yan ang gamit mo to protect yourself. Kung meron kang isang hindi magawa, then the more you need to do the three. You can do distancing in church, di ba? You can improve ventilation in church can be very good. Ang tataas ng
Pwede rin
ng
sa labas na
kisame
magmisa.
nila. O pwede rin yung iba nga sa garden nagmimisa, no? So this, and then you can wear your protective equipment. And siguro pwede nilang isipin they should shorten the mass. Diba? Para
Hey, Doctor,
hindi kasama ng matagal.
Dr. Ana, does that mean, for example, is a bus, if you apply the apat, and if you like ventilation, does that mean the bus mas mabuti nang nakabukas sa mga bintana kaysa naka-aircon?
Yes, I would
Sinabi na
agree.
yan nun eh, yeah.
Oo, I would agree. Actually, di ba sa private vehicles, tayo ina-advise na hindi na natin
Yes.
isasara ng maigi yung mga bintana, leave it open about 3 inches. So I would also emphasize na kung pwede sa mga bus, no, we should do the same thing.
It's counter. Sige, okay.
Okay.
Well, okay, you have acknowledged that, a surge is, threatening us at the moment if we continue on this way, no? Assuming that we do, how is the state of our critical care facilities? Are we ready, for example, if this surge happens before Christmas? Let's just say in the next 2 weeks.
Well,
Doctor,
so yung surge,
anybody, yeah.
Ana, do you want to, sige. Yung,
Well,
it will depend.
Yeah, go ahead.
Go ahead.
Sir.
Dr.
Well, I was
Lance,
just
go
going
ahead.
to say, it will depend on how bad the surge is, Even the best healthcare systems can be overwhelmed by a huge surge. Like, US was overwhelmed, di ba? And our system, and they're continuing to be overwhelmed. People are dying in ambulances and in emergency rooms, unable to be admitted, no? And healthcare workers are, really taxed. Yung kanilang ability to care is really taxed to their limits, no? Burnout na silang lahat. So, and that's the healthcare system of the US. So, sa atin,
Yes.
if you think about yung July and August, we almost filled it up. That's about the time we called for the timeout. Talagang zero na ang vacancies sa ICUs at that time. There were queues. Ayaw natin bumalik sa ganun karami. Basta manageable.
Kaya dapat agapan ngayon pa lang. No?
And that's why we're doing this announcement. Para kung dumami man, I almost think it's unavoidable, the dami. Ang gusto natin kung dumami man, huwag lumampas sa kakayahan ng ating mga hospitals.
The research has said that we are approaching, one, because we're now at, I think, 0.93, no? Or yeah. So if you factor in the unreported or delayed reported cases, that we could very well be already in the ones. Is this something that matches the July to August figures? And are we ready, considering that in the holidays, many of the health workers, how are they? Are they going to take leaves during the holidays also? I imagine that they would. And will you be short on manpower during this period?
So thank you, Lucy, for recognizing that. That's precisely the reason why we're actually making these calls. Natural naman, di ba, sa kahit anong workplace na pag dumating ang Pasko, marami nagre-request ng leave. Hindi naman exempted ang mga hospitals and healthcare facilities, no? Although I would recognize that malamang kakaunti ang papayagan, mababawasan pa rin ng tao. So, bakit naman natin gugustuhin na dagdagan pa ang problema natin kung nasa sa kamay naman natin yung pag-iwas, 'di ba? Ang sinasabi lang naman, let's avoid crowds, let's be very thoughtful about how we plan our movements, let's continue to use our PPEs properly, no? Hindi naman mahirap. Baka naman napapagod lang yung mga tao, pero hindi kasi tayo dapat napapagod magpaalala. And that's what we're doing.
Okay.
But yeah, takot yung one, eh, no? Anyway, yeah, thank you.
We're talking about the R naught.
Yes.
Anyway, Dr.
Yes.
Ana Ong Lim and Dr. Tony and Leonila Dance and kanina with us was Dr. Winlove Mojica from the Healthcare Professionals Alliance Against COVID-19. Doctors, maraming salamat po for joining us tonight.
Thank you.
Thank you very much.
Salamat po.
Maraming
Stay
salamat.
safe, everyone.
Ingat.
Please stay safe.
Okay, rin po.
Apat
Thank you po.
dapat. Okay. Apat dapat. Ayo, apat.
Saan niya ginamit yung
dapat.
apat dapat? That was a
Apat
slogan.
na sikat. Apat na
Hindi,
sikat.
hindi, iba yun. Iba yung panahon mo yun. Pero yung apat dapat, somebody used that as a slogan before. I'm trying to rack my brain.
Magic flex down.
Magic Flakes.
May free commercial pa rin. Ano ba?
Sige.
Okay, sige, naglalabasan yung mga edad. We'll just go into a break, so please stay with us.
Welcome back to the Chiefs. We're now in the final stage of our conversation. And I would like to welcome Undersecretary R.J. Echiverri of the Department of the Interior and Local Government. Good evening, Usec. Welcome po
Good evening.
Yeah.
Yes, good evening, and thank you for having me again in your program.
Hi, sir.
Usec,
Good evening.
Good evening.
Usec,
Good evening.
recent days, parami pa rin yung mga crowds sa mga shopping areas, mga commercial centers. Are you planning any new directives or exhortations to local government, siguro sa barangay, to improve crowd management, crowd control? Meron po ba kayong mga pinag-uusapan ngayon, especially in Metro Manila?
Well, even before that, when we were trying to implement the quarantine and the lockdowns, we already mentioned that to all LGUs to create ordinances for proper monitoring, for contact tracing, and crowd control. That goes along with crowd control. That's why if you would see, Mayor Isko Moreno in Divisoria managed to so far do that in controlling the number of shoppers. But I agree with you, ako, nagpupunta rin naman ako sa mga shopping malls. I'm surprised with how SM North EDSA is, napakarami pa rin, parang walang pandemic, and including Trinoma. That's why I think we really have to call the attention again of city mayors, most especially on highly urbanized city areas, to monitor the shopping malls. Not to mention, yung mga dine-in restaurants,
Yes.
That's one of the reasons why there are a lot.
Yeah, but Yusek, if you don't mind, yesterday we were talking to Nabotas Mayor Toby Chanco. Tapos kanina I was watching the news and reading the news with Mayor Zamora in San Juan, and it's one thing to remind LGUs, to be mindful of these things, but they're also saying confusing din yung messaging from the national government. And because even earlier, I was watching para spokesman Harry Roque basically encouraging people to, hindi, tama mag-malls tayo kasi it's the economy, kawawa rin yung, which we also understand. But would you acknowledge that even on the national level, there is a very conflicting messaging here na ingat pa rin kayo, disiplina pa rin kayo sa malls, but at the same time, the message is, go ahead. In fact, Harry Roque said kanina, sa totoo lang, maluwag pa rin yung mga malls eh.
Yeah, I haven't watched the total interview of Secretary Harry Roque, but we believe, no, there's really clarity as to the national policy with the local government, because we always conduct monthly meetings with them, and clarifying on the national policy. As a matter of fact, there is an IATF resolution number 79 amending the omnibus from the age of 18 years old and 60 to turning it to 15 years old ang minor, and 65, no, increasing it to 65, na po pwedeng, na hindi po pwede pala, no, yung 15 and below and 65 and above, they're not allowed to go to the malls or elsewhere. Kaya na siguro yung 18 to 50, from 16, 17 and 18 who are minors, yeah, yung sinasabi nyo can be allowed with parental supervision to go to the malls. But for seniors 65, I'm sure si hindi naman 65, no, you could still attend the malls if ever.
Teka, sino tinuturo niyo, Usec?
Oo, taka lang ha.
Sino pinapakinggan ninyo?
Yun nasa taas po, yun nasa taas.
Si Ami.
No, but policies is one thing, protocol is one thing. What we're talking about is the messaging. Ano ba yung message? Should people stay away, or is government encouraging people to go out? I think that's what even the mayors are saying. We really doon kami nalilito.
I could just follow what our secretary of the DILG just mentioned during the meeting. Di ba yung kanina kong madaling araw na broadcast nila, na sabi ni Secretary Anyo, for Christmas parties, totally wala, carolings wala, any social gathering wala. So looking into that messaging, it's very clear on our end that talagang pinagbabawal ang social gatherings. And based on what I'm listening to the doctors a while ago, tama naman po sila.
Pero papayagan na daw younger people, minors, meaning below 15, although wala pa yung cut-off age dun sa mas mababang cut-off age. So, matatagal na naman yan. Kaya nga sabi ng mga mayor, medyo nalilito sila kung paano gagawin nila.
Well, kung nalilito po sila, that's probably our job of, again, calling for a meeting and coordinating with them properly. Any queries naman po, each USEC and ASEC have designated local governments to monitor and supervise. So they could always ask us naman. And again, let me just be clear on that. We consistently and closely coordinate with the LGUs of anything that might be complicated or, as you have mentioned, not clear. So that's our job, no? To clarify the national policy and the messaging at the same time. And that the messaging is clear. Social distancing should be observed, no social gathering.
Meron pang isang pinag-uusapan ngayon during even as the holidays approach, yung pinaghahandaan by January at limited face-to-face. Sa ngayon, marami ng pinag-uusapan, tinitignan ng mga models. And today, the Department of Health said they could support, Secretary Duque said they could support the resumption of face-to-face classes in certain areas. Ang DILG has been against face-to-face classes. Ano po yung latest status ng mga discussions sa inyo ngayon on this issue?
Yeah. Just to be clear about it, the DILG alone is not against it. We always based our policy with IATF, meaning the Department of Health. So kung ano sasabihin ho ng Department of Health, that is where we based our policy. So kung sinabi ho namin na bawal, kasi Department of Health, ang head naman ho ng IATF, doon lang ho kami gumagawa ng policy than no face-to-face. Now, I think Secretary Briones of the Department of Education is very clear on that matter. Baka hindi pa rin ho na mangyayari.
Usec,
Usec,
can we talk about
sige.
enforcement? No? How do you think you can actually monitor what goes on essentially, in homes and even in private spaces? No, how do you know that they're not violating the 10 people gathering rule? And then out in the streets, for example, in marketplaces, in places similar to Divisoria, what is the instruction to the policemen on the ground and the barangay tanods? Are you going to be stricter now? And at the same time, people are being encouraged to, yes, go out and help the economy by spending. What exactly is the instruction? Is it maximum tolerance, or is it stricter enforcement? How do you communicate that to to the policemen and to those in charge of enforcement?
Actually, Luchi, your question is really also a question not just for the Philippines but to the whole world. No, it's trying to balance between economy and public safety and health. The answer to that question is difficult. How to balance it is really a challenge for us, and we really allow the local government to have that say on how to balance economy and health. That's why our instructions to the local government is strictly to follow the IATF policy. And at the same time, do the economic activities, provided there's no violation of the IATF policy as to the minimum standards and the social gathering. Siguro we could manage, no, just to balance it. Ang kagandaan nga ho neto, I mean, the doctors have mentioned a while ago, nag-deep down na yung curve. Yung curve. So at least what we're doing right now, they're all observing, adjusting, observing the IATF policy, and doing their work, doing business still. Medyo yun nga lang, we really have to monitor it. And how to monitor it? There's so many very innovative ways. We use CCTV. Kaya nga yung CCTV monitoring is very encouraged to all LGUs. That's why the MMDA is also looking into it. Monitoring all areas of public places. That's why the local governments are investing much more on CCTV. That's why in Caloocan alone, we really encourage all barangays to have CCTV. And we use that as our basis of monitoring. And the police are also using that as the basis also for monitoring because they cannot always cover the whole area. That's why the barangays are encouraged for that.
Usec, meron na naman tayong basis. We're talking about, we're talking about things as we see them moving forward. But the reality is we've also had some experience now with the economy starting to open up. I'm just wondering if you could report to us or share with the public, what are the common problems and the more difficult problems that you've been monitoring so far?
Well, again, local governments are different by region. They have different challenges by region. Not to mention NCR and Region 7, which has the highest number of COVID, are still experiencing the balancing of economy and observing public safety and health. So again, really the difficulty is balancing, to balance how we could do business without further infecting the public with COVID. That's really the challenge, and how to balance it. The difficulty of the national government creating a policy of a good formula for that is difficult. And we allow the local government to have an elbow room to work on that.
Are you finding that there are more violators now, more arrests? Now that there are more people outside of their homes, nagmamatch ba yung... I guess I'm trying to make a sense, to get a sense of how strict enforcement is becoming or has become or will become.
Actually, Lucia, at this point in time, tuloy pa rin naman yung intensity of being strict. Pero one thing that's good right now, nag-a-adjust na yung public sa sitwasyon ngayon. That's why right now wala na masyadong hulihan because they are, observing it. And I think they are aware of the risk. So, kaya nga minsan may proposal na tanggal na lang yung face shield. Kasi face mask na lang daw dapat. There are proposals like that because it's only the Philippines who's implementing that. But still, we're still trying to be safe, no, on that matter. We tend to overdo things, pero I think that's okay. Kasi it's really for public health, and the public is responding well on that.
But isn't overdoing?
That doesn't seem to
Excuse me.
square with what Father Austriaco, for example, we had him the other night, no, and he was pointing to what he calls a seemingly pandemic fatigue in place, and he clearly pointed to a behavioral, in effect, causes for the surge. People are becoming more complacent. They're not wearing their masks as often as they used to. They think that everything's now namby-pamby better. So that doesn't square with what you're saying, no? Kasi iba yung version nila. Sa kanila nga, hindi nga naging complacent. So I'm wondering whether that's being matched by stricter enforcement.
I wouldn't know. I couldn't measure that carefully, Luci, but I will have to look into that, and again ask our regional directors on that question, of the complacency. But it should not be. I'm proud to say, we're not like the United States, suffering right now with the cases of COVID. And the Philippines is far off better than Europe and United States in terms of managing it. And we're proud of it. And I think the public recognizes it.
But sir, at the same time, kasi there have been some. I'm sure you've seen all the comments on social media and in the news.
Sorry,
leveled against, for example, Secretary Harry Roque, for being part of that gathering in Cebu. Granted that it was not his gathering, he was not the one who organized it, but it was done in front of him, and that he could have done something about it. I suppose I'm going back to Robbie's point a while ago about the messaging of the government. Is the messaging clear enough so that people can see not just the message, but as well the examples being given by public officials?
I can only speak for Secretary Anyo. I cannot speak for Secretary Roque.
Yes, sir.
I'm sure Secretary Anyo observes.
Yes, sir. I say that kasi, sir, in the end, syempre, the enforcement boils down to DILG.
I cannot speak for Secretary Roque.
Usec, your department is also in charge of the local jails. Kumusta naman po yung situation doon? Kasi dati nagkaroon ng spread in several jails, especially outside Metro Manila. Kumusta na po ngayon?
Good thing you mentioned it. The BJMP, during the early months, really had difficulty because there was really an incident of COVID inside the BJMP. But right now, they followed a strict plan na wala munang dalaw. Kasi doon nagagaling yung cases of getting infection. But they allowed this e-dalaw yung through social media that they could, allow the prisoners to talk to their loved ones through these platforms. In that way, they could prevent the spread of the disease. Because ang sinasabi naman ng mga experts natin, di ba, for as long as you are confined and you don't allow anybody coming in from the outside, you're safe.
Paano
so far, na-control na po.
Paano magsa-celebrate yan? Siyempre, they have to celebrate kahit paano. Paano magiging celebration nila for Christmas? O walang celebration?
Just like us, sa labas. Siguro i-celebration rin po.
I-celebrate.
Usec ang kawawa yung mga nasa evacuation centers, no? And in provinces like Cagayan, ang dami pa rin nasa evacuation center hanggang ngayon. And in fact, because of the, I believe there are 2 LPAs coming into the Philippine Area of Responsibility, and they're expected to bring more rain. So hindi na naman daw sila pinapauwi sa mga bahay nila. You know, what kind of guidance do those LGUs get from the national government as far as the evacuees are concerned, especially because there's hardly any physical distancing that takes place in those centers?
Yeah, well, as for guidance, it's let's
Hirap kasi
let's
doon,
not
di ba?
let's yeah, I know,
Yeah.
but let's give credit to the LGUs. Uh, and I would say, no, just to directly answer your question, very minimal ang magiging participation ng national, because we trust the local governments to really respond to the needs of their constituents. Besides, they already receive their financial aid through their disaster calamity funds. And that would be enough, really, to address their concern. The national will only be there to only augment the things that they cannot answer. But we really trust their capabilities. And just to mention a few, there are there are a lot of good practices, by the way, na hindi nakikita ng mga media at hindi na-cover. And they really are good. No? We really have to give them credit for doing a good job also. And we don't take them for granted. And we are also listening to their needs. But as to our participation, medyo mababaw na, because disaster is more of preparation. And on the part of the DILG, we have capacitated the LGUs on how to prepare and address all disaster. So on our end, medyo minimal na, kasi dapat alam na nila kung anong gagawin nila by the time the typhoon comes.
Okay.
Okay.
All right.
Undersecretary Rico Judge Echiverri of the Department of Interior Local Government. Yusek, maraming salamat po for joining us tonight.
Thank you,
Thank
sir.
you for having me, and stay safe. Thank you.
Thank you, sir. Stay safe then.
Okay. Actually, sa Cagayan, na-COVID pa yung social welfare officer doon. So yung buong CSWD nagsara. So yung ayuda nila, hindi nila makuha. Yung restaurant kanina sa frontline, nakakaawa itong mga to. Tapos ngayon pa, sinasabi sa kanila, you can't go back to your homes because of the LPAs that are coming. Wow! Ang big one, di ba?
No more typhoons.
Yeah. Well, hindi naman daw typhoon, LPAs, so ulan. Yeah, ulan
Pero pwede na lumas.
Alam mo, the discussion a while ago about the plastic barriers in public places like restaurants, if you Google it, ang daming articles raising questions about the effectivity and possibly the harmfulness of putting up these plastic barriers. Kasi nga, if you put up these barriers in places where people come and then go, and then another person steps in, you might be leaving a cloud of mist enclosed in that plastic barrier for the next customer.
Right.
Kailangan ko i-disinfect yung bawat cubicle kapag ganon, di ba?
Hindi lang disinfect, you have to ventilate it. Otherwise, it's trapped there, floating around for the next customer to come in and inhale.
Ang hirap talaga, pabago-bago. Remember when in the earlier days of the quarantine, yung sa mga jeepney, yung may barrier na plastic.
Yeah, di ba?
Di ba?
Tapos
sabi na,
hindi kailangan yan.
hindi kailangan. Sinasabi, isipin mo nga naman, tuwing may dadaan doon na nakayuko, didikitan mo yun. Yung buong hilerang yun, didikitan mo for the next person na didikitan niya rin yun.
Tsaka lahat ng
So yun, that's one example of a practice that they had to reverse completely.
Lahat tayo nakakapala ngayon dito sa response natin. Apat dapat.
Tanda mo yung apat dapat? Tanda.
Ano na nga ba yun?
Apat dapat ng Jose.
A, ventilation.
Ano may apat game? Dali. A for
Air. Air ba? Di ba?
Air ba? Oh.
P is physical distancing.
Physical distancing.
Tapos
Always
A,
always wear your mask. Oh.
Just
Parang
Tapos,
ang layo ng isa, ang layo ng isa mask.
time.
No more than
Time is
half an
time,
hour.
no more than 30
time. Oh,
minutes.
T is 30 minutes. T for 30 minutes.
Okay.
So,
Pwede rin.
dapat para kang scout ranger pag kumain.
Pwede.
Mabilisan.
Pwede.
At ang mga ninong walang excuse. Hindi nakakahawa ang gifts. Pwede magbigayan ng regalo. Walang danger dyan.
Kung hindi naman
Kaya
i-ATM mo
ikas na lang daw. Online transaction na lang daw sa mga inaanak.
Ninong Robby, i-transfer mo na lang ang funds.
Walang load. Walang load.
Okay.
Okay.
Mauwi tayo sa Pasalod. Okay? Sige. It's a Tuesday. We have three more days to go before the Friday. So, malapit na. That'll be all for this Tuesday edition of the Chiefs. We hope to discuss it. We'll keep the conversation going. I'm Edwin Gaupo News.
I'm Mami Paminton of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay and we are One News.